Hello, my name is Lucy and I share videos around the topic of long COVID, chronic fatigue syndrome and mind-body approaches that I've found helpful. So today's video is talking about heart rate variability, heart rate and measuring your steps. So I don't go into detail about what heart rate variability is. If you're looking for detail, you'll probably find that somewhere else if you Google, or if you have a look on YouTube, I'm sure someone will explain it in detail. But I just wanted to talk about the benefit or the drawback of measuring heart rate variability or your heart rate or your steps when struggling with long COVID or chronic fatigue syndrome. And before I begin, I'm not a medical professional. This isn't medical or mental health advice. This is just my own thoughts on it based on my own experience recovering from long COVID and chronic fatigue syndrome. The other thing to say is that if you are using heart rate variability or monitoring your heart rate or your steps and finding that helpful, and when I say helpful, I mean it's reducing your symptoms and you're slowly progressing and getting better, then that's great, and anything that helps is a good thing. So I know that there are uses for these things, but with chronic fatigue syndrome and long COVID, I also think they can feed into some distraction or vicious cycles that we might already struggle with when we have these conditions. So naturally, if you've had a long-term health condition like long COVID or chronic fatigue syndrome for a long time and you're struggling to get better, you will be looking for things that are going to help. And when it comes to devices, sometimes it can feel more reassuring or more definitive to have a device that's giving you exact metrics based on what is happening in your body. So I completely understand why people decide to measure their heart rate variability, their heart rate or their steps or something else. Often it's because we're looking for answers and it's really hard to know what's going on and how to know when we'll be okay to do something or increase our activity, or when won't be a good time and when we need to rest. I tracked my heart rate variability for a few months when I was really unwell with long COVID, and for me, I took a measure in the morning, and each morning I would realize that my heart rate variability was very low. So in terms of heart rate variability, a low score is related to worse health or that your body is struggling, compared to a high heart rate variability, which means your body is working really well and it's in recovery mode. So when I would see this every morning, it would make me feel under pressure to do more, to find out what was going to help me. And it added pressure that didn't really help for me. So the other thing that I found with heart rate variability was I would use it at different times of the day to try and figure out if my activities were helping my body relax. So for instance, if I meditated, what would my heart rate variability be? If I did breathing exercises, would my heart rate variability change? And I did find that breathing exercises very slightly improved my heart rate variability, which I'm pretty sure would be predicted by the fact that slow breathing does help our bodies relax. But I also found that some activities that I did that I found relaxing and that I felt better after doing actually lowered my heart rate variability. And this was a bit confusing because I was thinking, well, this activity has helped me feel better, so I want to keep doing it, but maybe I shouldn't keep doing it because it's making my heart rate variability lower. And really there's just so many variables that come into play with heart rate variability. The outlook that I have is that our heart rate variability is not the cause of the problem, it's just a result of the health issues that we have, which means that as your health improves, your heart rate variability will likely improve as well. And for me, I couldn't figure out a way to impact my heart rate variability in a meaningful way that would dramatically change it. And focusing on the fact that it was very low every day made me feel worse rather than better. It made me feel as though things were more out of my control than in my control. And with heart rate variability, if you're wearing a heart monitor, it can show you abnormal heart rhythms, things like that, which came up quite a lot for me and also just generated anxiety. So if you're measuring your heart rate variability or your heart rate or your steps, you can ask yourself, is this helping me? Or is it potentially bringing my attention to something that is causing some anxiety and some worry about my body? In a previous video, I talked about how important it is to build up positive associations with activity and with symptoms so that they no longer seem dangerous or unsafe. And when we're measuring something on a minute level, like our heart rate or our heart rate variability or our steps, it can be a form of hypervigilance where we want to keep checking, where it, rather than sort of scanning our body for a problem, we're able to check our phone to see if there's a problem. And it can be, even if you don't feel really anxious when you're doing it, hypervigilance is associated with anxiety because it's that state where you're looking for a threat and you're trying to figure out if something bad could happen and know how to react to that. So using tools like heart rate variability or checking your heart rate or checking your steps might not be useful. If a doctor has recommended doing this, or you have a heart condition, or there's another health reason for you to measure your heart rate or your heart rate variability, then by all means follow your own medical advice around that. If, on the other hand, you're checking your heart rate variability because you're trying to find answers for fatigue or for symptoms that go along with long COVID or chronic fatigue syndrome, just consider how it's helping you and what impact it might be having on you. How anxious do you feel, for instance, on a week that you're measuring your heart rate variability? How anxious do you feel on a week when you're not measuring your heart rate variability? Does checking those things make you feel safer in your body or less safe in your body? Does it help you with the belief that your body is healthy and that you can get better? Or does it impact negatively that belief? Many people do recover without tracking their heart rate, without tracking their steps, without tracking their heart rate variability. And the other thing to consider is, do you have personality traits like perfectionism? Are you an achiever? Are you someone who likes to do something in a very orderly way? In which case, this might be an extension of one of those parts of you that wants to control your situation and your environment to make you feel safer. And it might make a lot of sense for that achiever part or the perfectionist part that, of course, this is going to help because it's a metric and it helps us give us more information. But a part of recovering is being able to relax and live in a more balanced way, where we are able to reduce pressure that being a perfectionist or an achiever might kind of put on us. In terms of counting steps, some people will count steps because it can help them monitor how much activity they're doing. And again, if this is helping you, if your symptoms are reducing and you're getting better, and that's as a result of counting steps, then maybe it is something that's helping you. But for a lot of people, it can become a structure that's self-imposed, where we're trying to keep ourselves sort of walking on this tightrope of not doing too much and not doing too little, down to a step. And it can feed into our belief that our body is unhealthy, or that doing additional steps is dangerous or unsafe or will make us crash, when if our body was healthy and we were using mind-body approach, we wouldn't want to be thinking about additional steps in that way, at least for the long run. That type of thinking might impact how helpful this approach is going to be. It's very common that with using some sort of device to measure our heart rate or steps or heart rate variability, that we're looking for answers, and it can be really unsettling not to have exact answers about what is right for our body, what we should do, what we shouldn't do, especially if we don't like uncertainty. So in other videos, I go into a bit more detail around what exactly did help me by doing emotional work, looking at parts and in the impact of different parts, the impact of beliefs that I had around what I was doing, and building up beliefs around my body being capable and my body being healthy. So I'm not going to go into that in this video, but if you haven't seen those other videos, you could check those out where I explain what did help me. If you found this video helpful, please like and subscribe. If you would like to ask a question or leave a comment or tell your own experience about using heart rate variability or measuring steps or heart rate, write that below. I have a private Facebook group which you can find the link to in the description. And thank you for watching, and I will see you in the next video.